Good evening to all. A very good evening to all. I, on behalf of Institute of Pulmocare and Research, cordially invite you to the 12th session of Pulmocon 2021. The topic we will discuss today is about ethical and medico-legal issues faced by a doctor in day-to-day practice. To chair the session, I would like to invite Dr. Saha. Dr. Saha is an eminent pulmonologist and teacher, having worked in several medical colleges in West Bengal. He has a number of publications in national and international journals to his credit. Currently, he is a visiting faculty in Manipal Medical College. I welcome you, sir, and I request you to kindly proceed over today's session. Thank
you. Good evening and welcome. We as a doctor has taken oath when we passed the MBBS course, and this has been that we have some ethic in life. But today's medical scenario has changed a lot. There is a lot of litigations, lot of court cases and everything. In our time, when we joined this profession, there is only the medical colleges, and there is no corporate house, nothing else like these things. There is no Consumer Protection Act. And now, today, there is a lot of corporate has come, the Consumer Protection has come into being. Now there is a lot of medical legal complications by the doctors and the patients. So today's program is academic and also non-academic. It is a very practical issue to the doctor. And today's program, as you have heard, that is the ethical and the medical legal problems faced by the doctor in day-to-day practice. And this is very important. Without doing this, we can't really continue our practice, whether we are in corporate or in private or anywhere else, even in the medical college. Now, without wasting time, I now sincerely request Dr. Biswajit Sukul to give his lecture, and he needs no introduction. I ask Dr. Biswajit Sukul to really start his lecture. Thank you, Dr. Sukul. Please.
Okay, thank you, sir, and also thank you, Dr. Bhattacharyya, for giving me the opportunity to speak before you. Now, you will appreciate that the title itself is the medical and ethical issue or medical legal issue of the problem faced by the doctors in day-to-day practice. Now, initially, the relation between the doctor and the patient was like a god. The patient or the patient party considered the doctor to be a god. But with the changes of the time and changes in the social pattern, the relation is now the caregiver or provider and taker. So, if any misunderstanding occurs between the doctor and the patient, or the patient party and the doctor, there is a huge problem will arise. So that's why in day-to-day practice, what we are facing, I'll just give a brief deliberation on this topic. Now, if you break your neck and if you have nothing to eat, if your house is on fire, then you got a problem. Everything else is inconvenience. Pain is inevitable. Suffering is optional. And last is nothing but the bend in the road is not the end of the road unless you fail to make it turn. Just like examples of Ultadanga Bridge. You will appreciate that few years ago, one slab from the Ultadanga Bridge has broken and fallen. So if you don't know the bend of the road, where it is ending, so you will be in problem. That's why our topic, we can divide the problem. That is, main problem can arise at the emergency or casualty department, number one. Number two, what are the problems arise in the outpatient department? And lastly, the indoor patient department. So I have classified in three ways because it will be very easier for us to understand this thing. Now, the main thing is that emergency department. Now, you know that now when we were very junior, we were in the casualty department. Suppose 2 friends or 3 friends are there. The patients are sick, and the patient party are emotionally charged. They are coming in the hospital with sudden acute pain or asthma or whatever it may be. But that is a very big thing for them because they have left their house. So in that cases, if there is any miscommunication or misunderstanding between the doctor and the patient, then there will be a ransacking of the hospital, destruction of the hospital property, even assault to a doctor. So I will just give what are the problems can arise and side by side the remedial measures. What measures can be taken to prevent this thing. Now, in case of emergency, first of all, you guard the patient interest first. That is, immediately attend the patient and admit if it is a case of admissible cases, if possible. You have to attend the patient first, otherwise the problem will arise. Number two, public tackling, that is an art. That is individualistic, but you will have to tackle it. Because when we were in the health center, you will appreciate that the problem arises, problem crop up, but ultimately we have developed our skill to manage that thing. So public tackling is very important in that cases. Now, writing of the medical legal report, as for example, injury report, because when we will write the injury report, that is very important. As for example, suppose a patient came with a huge number of party, maybe or may not be that patient unknown or known. If known, take the name. If unknown, write unknown. Brought by you, maybe fact, maybe genuine. Just write the name of 2 persons. How the injury occurs, you just write it. And finally, lastly, identification marks is very important because it will be deal in the court of law after 2 or 3 years. So identification mark is very important. And finally, in case of injury, when we write the injury report, the size of the injury, the site of the injury, whether the injury is a grievous or simple, what are the weapon used for that causing injury, and finally the age of the injury. If you write in that way, that it will be easier for all persons to understand, and you will face in the court of law very smartly. That is very important. Now, preservation of the valuable articles in case of emergency. Suppose a person came attended in the hospital at 12 midnight with a huge ornament on his body or on her body, along with huge amount of rupees. You just take it, don't write gold, don't write silver, that is golden or white. In case of ring, don't write chuni panna, you just write red stone, white stone, yellow stone, and make it in triplicate copy. One copy should be handed over to the police after receiving, if the police brought that patient. Another, if the ward master is there, then handed over to the ward master with the proper seal and keep it one copy to you. So that in next morning, he cannot claim that amar kache ei chilo. So that is the seizure list like police, the preserved article. And tackling of the broad death cases, it is nothing but, you know very well that in case of broad death patient, medically, you will not issue the death certificate. That is very mandatory. But what practicing is doing, we know. But in case of broad death patient, medically and ethically, it should not be, death certificate should not be issued. That is the main thing. Next, at the outpatient department, that is in nutshell in the emergency department. The outpatient department, mainly their police personnel came and give a salute and brought one paper or prescription said, I want rest. So rest. So issuance of the various certificate is very important. How we will issue the certificates, what are the golden rules of the issuance of the certificate, that is very important. Now, do you think that diagnosis is a mistake or negligence? This is not at all. Provided, if a doctor left no stone unturned but fails to diagnose in an obscure case, it is not a negligence act. Left no stone unturned. That what I mean to say, if a person is suffering from pyrexia of unknown origin, the relevant investigation should be given, including nowadays COVID. So malaria, tuberculosis, whatever it may be, the reason, possible reason. But if you miss to give investigation of malaria and the patient's finally diagnosed as a malaria, it is a negligent act. But in case of a doctor, if doctor left no stone unturned but fails to diagnose in specially obscure cases, it is not a negligent act. Now, right to possession of the report. We know very well the patient has the right to take the report. Next, medical practitioner is bound by the law to issue the certificate. I cannot avoid myself that I will not issue the certificate. What are those conditions? Under Mental Health Act. Certainly we are not this, but psychiatrists are involved in that cases. Notification of the infectious disease. If any epidemic occurred, it is the duty of the block medical officer or doctors working under the CMOH of that concerned district to inform about the notifiable disease with a particular time. Sickness benefit insurance, sick certificate, fit certificate, that is we are giving. And medical legal report, what I mean to say, birth certificate, death certificate, injury certificate, or age certificate. We cannot avoid this thing. We are bound to give. Yes, no doubt. Injury certificate is important, but age certificate who will give? In the district level, generally the released in Calcutta-based medical colleges, we are giving the age certificate. So we are bound to give. That is very important. Now, what are the rules? Now, always write the prescription certificate in a letterhead pad having name, address, qualification, and other necessary documents. State only those facts which are true and within personal. That means that suppose I have examined the patient today, that is 26th December, and January 15th patient again came to me and give a said, I am fit, plus examine me and give a certificate. So my writing sentence will be, he was under my treatment from 26th December to till mid of January, that is 14th January, and he was advised to take rest during that period. Now today I have examined the patient and he is fit to resume his duties. But if the patient presses you that give me a certificate from October 26th, you cannot write, because you don't know from October to December what happened. If you give that certificate, that will be very harmful, maybe harmful to you. So always state only those facts which are true and within personal knowledge. That is very important. And limited to the period during which the patient was actually under the care of the practitioner. I have already explained that thing. Now, in case of prescription cases, medical legally or future litigations, it is my suggestion that you make it a duplicate copy, mentioning a duplicate, and preserve for 3 years. Because record keeping is very important in that cases, medical legally. There are certain periods of record keeping of indoor patient, outdoor patient, x-rays and prescription, because one department in the medical college is also there, which is known as MRD section. There's a medical record department section. So keep it for 3 years. Now, how will you hand over these certificates? Now, handover is that you hand it over to the patient or to a third party with a written authorization. That is very important. And before handing over, always have it signed with date by the patients and to be attested by the practitioner with a legible signature and registration number. That is Very important. So never issue death certificate in case of sudden death, in case of suspicious death, in case of unnatural death. I am explaining what do you mean by sudden. The sudden means patient was all right, patient suddenly developed uneasiness. The family members of the patient took him on the way, he expired, and after that, arriving at the hospital, he was declared broad dead. Don't issue death certificate. That is a broad dead cases. Suspicious cases. Suppose one person, after taking his meal in the night, entered in his room and closed the door. Next fine morning, after repeated knocking to the door, he is not responding. So after breaking the door, he was found lying on the bed. And that death may be natural or unnatural. That death may be due to severe microinfarction. That death may be due to CVA, or death may be due to some poison. So in that cases, if the patient comes with a broad dead history, don't issue death certificates. And you know very well that other than natural death like burn, hanging, dowry death, poisoning, strangulation by ligature, all deaths are unnatural. So in that cases, death certificate should not be issued. Body should be sent to postmortem examination through police. Now, indoor patient, that is very important in that cases, that bed head ticket maintenance is very, very important. So if you maintain the bed head ticket very properly, so good maintenance of BHT can save a doctor, and bad maintenance of BHT can pull a doctor. I am giving one example. Suppose one patient with a history of such and such and history, ultimately expired one night, 12 midnight. Before that, we know that patient was gasping, blood pressure is such and such, pulse is so, Dedifilin, decadence, etc. So 2 steps, 3 steps, ultimately patient found dead. At the same time, suppose you are attempting to save the patient at 11 night. At the same time, on the sister's part, BHT, feeding is given. Can it possible? So good maintenance of BHT is very important. Diet chart, investigation, how you proceed the cases, what happened after examining the cases. You just put your findings day-to-day basis. On the left side, you put your findings. On the right side, you write your advice. That is very important. Regular visit. And next declaring death and issuing the certificates. That is very important. Death certificates. Negligence, I'll give in brief. Dealing with the patient and patient party. Here, the soft, sympathetic, and sober attitude always solve a lot of problem in that cases. Now, if the patient is going to die, then one duty of a doctor is that in absence of magistrate, taking dying declaration. So dying declaration, procedure of dying declaration, how you taking the declaration, just don't give any leading questions. Tell the patient if the patient is conscious, or otherwise gesture, posture, whatever, verbatim to the patient, not you are giving leading questions. And after that, you read it before the patient, take in presence of 2 witnesses and take a left thumb impression or something. If the patient is conscious, can also sign it.
Hello? Hello? I'm
Hello.
sorry for the interruption, sir. But sir, your slideshow is not moving actually. Your slides are not moving. Can you please do it full screen?
Okay. I'm trying.
Thank you.
I'm trying. Now?
No, sir, it's still not moving. I think you have to do it in slideshow mode, please.
Slideshow mode. Okay. Clear? Is it all right now?
Yeah, but
Madam?
yeah, it's all right, but kindly do it in slideshow mode.
Next, next is a problem in poisoning cases. Now you know very well that poisoning is nothing but a substance, either in solid, liquid, or gaseous form. When it comes in contact with the body, either by ingestion, or by injection, or by inhalation, or by contact, it causes ill effect and even death of a patient by its local or systemic action. Now, what are the duties of a registered medical practitioner in case of suspected poison? That is the medical legal issue. Now, duty of a registered medical practitioner in case of suspected poison is that, first of all, admit the patient. Next number is that take the history of the patient. If the patient is conscious, then try to save the life of the patient by giving treatment. If anything, just preserve it. And you will have to preserve the fast gastric lavage. That is very important. If police ask, you are bound to hand over it. And finally, if the condition is moribund and the patient is going to die, then you will have to arrange for taking dying declaration. And last but not the least is that when death occurs, then don't issue death certificate, inform the police, and arrange for postmortem examination. That is very important. So these are the duties of a registered medical practitioner in case of suspected poisoning. So maintenance of BST, you will have to maintain that, what I am telling earlier, that from admission to discharge, you have to maintain the BST very properly, because that is very important document. When any negligence charge comes against a doctor, the BST is a very good weapon. So good maintenance of BST can save a doctor, and bad maintenance of BST can pull a doctor. That is very important. Detailed present and past history should be written there. Now, what investigation you have suggested, that should be, and treatment given, that should be incorporated. That should be included in the BST. And the proper signature with the date for each visit, that is very important. On the left side, you just visited the patient, give a signature and date, so that regularity should be maintained. Mentioning the condition of the patient, if the party asks, you will have to, you know very well that patient is not well, patient is not good. Now, we cannot say after 48 hours, we can say not favorable at this moment, like that. Incorporating all the investigation report with date, that is very important. After incorporation, after giving investigation, when you get the report, you must put in the BST, just like your prescription, to future reference for treatment purpose. Mentioning who visited the patient, VP or VS. When we were in house staff, our teacher told, go and take one opinion from the neurosurgery. So would you please, sir, day of the ES or VS, would you, sir, kindly examine the patient and give your valuable opinion, sir? After giving his opinion, case seen by VS or VP, advise such and such. That should be included. That is very important. Now, negligence. Negligence, বাংলা কথায় যদি আমি বলি, তাহলে হচ্ছে যা করা উচিত ছিল না আমি করলাম। অর্থাৎ একটা বাচ্চা জন্মাবার পর রিসাসিটেট করার কথা ছিল, আমি করলাম না। আর যা করা উচিত ছিল আমি করলাম না, সেটাকে বলে অ্যাক্ট অফ অমিশন। আর যা করা উচিত ছিল না আমি করলাম, সেটাকে বলে অ্যাক্ট অফ কমিশন। So act of omission and act of commission, when it is present, it is called negligence. Number one. Number two, willfully lack of reasonable care and treatment of the patient. যদি willfully করা হয়, তার জন্য যদি কোনো পেশেন্টের ডেথ হয়, তাহলে that is a negligent act. Now, what are the ingredients of negligence? একটা ingredients কি? What are the ingredients which actually helps that it is a negligence? These are nothing but few D's. Now, D1, duty. D2, dereliction. D3, damage. D4, death. So, when the patient entered in your chamber, or if the patient comes to a hospital, other than emergency cases, the doctor and the patient relation established, And so the doctor is duty bound to treat the patient. That is very important. If you go outside your duty or deviate your duty, and due to that deviation or dereliction, any damage happens and finally death occurs. So it is a negligent act. So where the question of negligence comes, number one, is there any guard against it? And finally, why the doctors are not negligent. Three questions actually very important. Now I will first focus on why the question of negligence comes. You know that in our medical profession, the consent is very important. Without consent, we cannot move. So what is consent? Consent is nothing but a permission or compliance giving freely, voluntarily, without any fear, without any favor, knowing fully well for which purpose he is giving. So you have not taken the consent at all before giving intervention thing, like maybe diagnostic, therapeutic, or treatment purpose, what thing, invasive method. Informed consent you have not taken. That's a negligent act. Not informed about the risks of the management, but you know that in case of informed consent, we are explaining everything to the patient. Right is risk factor to everything. So that is very important in that cases. Wrong diagnosis, I have already explained that mere diagnosis is not negligent, but if you diagnose, not advised for malaria antigen test, but patient suffers from malaria, if it can be proved, then it is a negligent act. Outdated method and departure from what the patient consented. Now, if patient consented for appendectomy, you cannot go for valvotomy. That is very important. Preventive measures not taken. Suppose in our house staff shift life, we are doing intravenous pyelography. Side by side, one tray was ready for phenergan, adrenaline, etc. If any anaphylaxis or any allergic phenomenon occurs, we just give it. So preventive measures should be taken side by side. That is very important medical. You have diagnosed the patient 1 month ago. You have started treatment after 1 month, negligent act. Because you have already diagnosed, so you just try start your treatment. Falling short of skill or equipment, that is not the thing. Failure to refer. Now, refer is that the better infrastructure where the specialty is not available in your center, you are referring the patient for higher center for that purpose, but you have understood that patient should be referred, but after 7 days you are referring. If it can be proved that due to that delay, patient suffered a lot, it is a negligent act. And in our forensic subject, res ipsa locuta is very important topic. We have forgotten this thing. This is nothing but the speaks for itself. মানে হচ্ছে অ্যাবডোমেনে গজ পড়ে আছে, ইনস্ট্রুমেন্ট পড়ে আছে, এখানে কোনো কমপ্লেনেন্টে কমপ্লেন করার দরকার হয় না, ইটসেলফ নেগলিজেন্ট অ্যাক্ট। এখানে কোনো কমপ্লেনেন্টের নো নিড টু কমপ্লেন। Act of omission and act of commission I have already given. So what are the guards? Next issue. What are the preventive actions from negligence charge? Number one, congenial approach should be given from the very beginning, right from emergency department. Number two, communication should be open and frank communication between the doctor and the patient or doctor with the patient party, so that misunderstanding will be very less. Confidentiality, it is our medical ethics that we should maintain the confidence, because professional secrecy is one term in medical practice. It is a contract between the doctor and the patient not to divulge or not to disclose any information about the patient. That is our oath. So professional secrecy and confidentiality should be taken. Now, consultation, that is one of the defensive methods. Suppose if you say in the court of law that I have also consulted with one doctor who is either above your standard or at par with you, so that can be acts as a defensive phenomenon. Next, the updating of the record is very important. That is very important. Now, comment. There is a comment is nothing but the body language. Cooperation between the doctors is very important. Otherwise, the problem will arise. The negligence charge gulo cooperation ঠিক না থাকলেই problem. So, medical ethics আমরা পড়েছি. We know medical ethics. We know the medical etiquette. Conventional law of courtesy between the doctor is called the etiquette. So that should be maintained. Next, covering. Just like Western country, you are practicing doctor. Better you just cover yourself with the insurance like mediclaim, so that if any problem arises, that company will act or give on behalf of you. Circumvent is one term, not to disturb the patient or the patient party when they are very hot. And lastly, the confidence about yourself, what you are telling, what is your body language, how you proceed, patients are watching you. So that is very important. So doctor acted in accordance where the negligence is not there. কোন কোন ক্ষেত্রে negligence হবে না? Doctors acted in accordance with the practice acceptable by the medical field, number one. Out of two views, doctor accepted one view. Medicine is not effective, it is a misfortune. Mere omission of reading of recent journal is not a negligent act. Standing care is neither high or low. And other factors which is very important, suppose one of my friend, one of my colleagues is working in the health center, I am working in the peripheral center, and another I am working in the tertiary center. So like time, place, knowledge, facilities, etc. to be taken into consideration. That is very important. So I have just booked. What do we mean by medical legal? Medical case, we know what is medical legal. Now, medical case, suppose a doctor just attended one patient with a history of injury. If a doctor thinks that that injury caused by a foul play and it needs to be investigated by a law enforcing agency to fix up the legal responsibility, the case become medical legal. অর্থাৎ in case of road traffic accident, case booked as a medical legal. In case of snake bite, case booked as a medical legal. In case of burn, accidental burn, huge burn. In case of suicidal burn, booked as a medical legal. In case of sexual assault, booked as a medical legal. So these are the examples of the medical legal cases. Number one, accidental injury, either domestic or industrial or vehicular or railway, whatever it may be, booked as a medical legal. Because if you book that case as a medical legal, from the very beginning, you will have to be very attentive by noting down your injury report, so that in future, you will be faced in the court of law very organized way. Otherwise, you will be in problem. Number two, assault, homicide, suicide, or sexual assault, booked as a medical legal case. Then alcohol intoxication, not intoxication like the mere presence of alcohol. When the alcohol intoxication means drunkenness. Drunkenness means after consumption of heavy bouts of alcohol, person's number one loses his mental faculty. Number two, cannot perform the work safely for which he has been engaged at this material moment. And three, he is dangerous to himself and to the others. এবং যদি দেখা যায় যে after taking blood and urine sample, it is more than 300, so it is an intoxication, so booked as a, because there may be a head injury, there may be a fall, so booked as a medical legal. Victim or animal of ferocity, not like snake bite, it is just I can say that rabies, but in case of treatment should be given properly, otherwise no problem. Snake or insect bite, booked as a medical legal case. That is very important. Unconscious or comatose patient, what I am saying that, what I am telling that not hyperosmolar non-ketotic coma, not diabetic hypoglycemic coma, not uremic coma, but coma due to head injury. You just observe the patient for at least 24 hours. Don't discharge the patient. Observe the patient. Go for CT scan. If the Glasgow coma scale is less than 8, problem is there. So booked as a medical legal case. The unconsciousness may be due to head injury. Next, just burn like accidental stove burst, dry one, or liquid that is scared, hot water, or electrocution, or radiation, or lightning. In case of don't issue that certificate, that is a medical legal case. So booked as a medical legal case. Then criminal abortion. These are the very important thing. Now, here also one of the medical legal duties of a doctor in case of registered medical practitioner when he will face the criminal abortion is that duties are admit the patient, take the history from the patient if the patient is conscious, and if she avoids, then don't press her, then treat properly. Then if the condition is moribund, this patient is going to die, then arrange for dying declaration. And if death occurred, don't issue death certificate. It is a criminal abortion. Send the body for postmortem examination through police. That is very important. And drug overdose. And lastly, but not the least, is that anaphylaxis. These are the nutshell. I have arranged one examples of medical legal. There are various types of case which can be booked as a medical legal, but in our day-to-day practice, these are the medical legal case. So, how will you refer the patient? The referring rules is that medical officer who examined the patient first should give the necessary first aid. That is very important. Copy of the injury report with the discharge certificate must accompany the patient to the next of the institution referred to. And if the patient is admitted in the first hospital, then referred, the wound certificate copy must be immediately sent to the police officer to be produced before the medical officer in the second hospital. That is very important. And don't issue death certificate. What are the conditions? Number one, broad death case. Number two, person dead on arrival to casualty. Person dying after admission but before any diagnosis. Unnatural death, anesthetic death, surgical death, obstetrical death, death due to snake bite and lightning, and death of a woman in law's house within 7 years of marriage called dowry death, unnatural death. তাহলে কিন্তু ডেথ সার্টিফিকেট দেওয়া যাবে না। So thank you for thank you.
Thank you, Dr. Sukul, for the very eloquent and very wonderful and vivid elaboration of the facts. But one thing I request you that you have not, I like to request you to tell something about the ethical problems, which you have
ethical problem is what I am telling, that cooperation, that is very important. Suppose one doctor is sitting on the right side of the lane, another on the left side of the lane. The doctor, first patient goes to the first doctor, examined him, and he suggested some prescription. After that, it is the habit of the patient to cross-check it. Then he went to the second doctor. If he comments that Adhik mere enecchen, that is unethical. He actually should give, okay, he has given some prescription, some medicine, let us now see, I am giving some suggestion, let us see. That should be the approach. That is called the ethical aspect. You have to, a doctor, you must maintain your day-to-day life, because if you are advertising yourself unnecessarily, if you are attending the duty by consumption of alcohol, if you are seduce your patient or patient party, if you are charged with a sexual assault, that all are unethical and considered to be infamous conduct. That conduct is known as a conduct which is done by a doctor, which is considered to be a disgraceful and dishonorable among the professional brethren of good repute and competence. It is called infamous conduct or professional misconduct. The punishment is given by the State Medical Council or Medical Council of India, either warning or temporary or permanent erasure of name and registration number from the register. So these are the ethical practice. How you go? You just consult it with your colleague. I have given one example. That is the ethical issue. Yes, sir.
Okay, sir. Now, before going to the
Hello,
before,
please, sir.
Dr. Sukul,
Yes,
uh, before going to the audience, I have some questions to you.
yes,
Please.
sir.
First question is that now MNC has recommended, and MCI also, that a prescription should have registration number of a doctor, name of a doctor, qualification of a doctor, and residential address or a phone number. In my practice for 42 years of practice, now I see so many prescriptions come from the Calcutta or from the district that they don't have any registration number. What do you call it? First question. Okay.
As
Give
per
the answer,
MC,
then I'll go to the second question.
as per NMC or MCI, it is mandatory. In your chamber, you will have to show your registration number also. So if anyone not obeying this thing, this is not good. The action may be taken against them. So you should maintain what they are. You should follow that thing. That is that much I can say, because I can't violate this thing. Violation is not accepted, isn't it, sir?
Second question. So many patients come to us with the Google advice that this should be the dose, this should be the thing, and this can be done. What we should do, sir?
Now, sir, this is an art of tackling the patient. Now, your approach should be very sober, and you just say them, okay, sir, you have shown me, yes, that is written in Google, but according to me, I have experienced of 40 years of medical profession. So in my experience, I am giving thing, I am not following this thing because it is my choice. So I am treating the patient like that. Please accept my advice. That should be the approach. Google is not all. Google cannot say you what breakfast you have taken today.
Third question, sir. In telemedicine, which is still running, psychiatry, it is approved. In psychiatric practice, telemedicine is approved by NMC. In our case, in pulmonology, it is temporarily approved for the COVID situation. Suppose I do prescribe on telemedicine something, and after 6 months, he comes with these things. How much it is really, I am committed to that prescription. That I like to mean that I have prescribed something which is not recorded to me, and he shown these things, something. Is it accepted by the court? Something
Number
bad?
one, sir, initially in March 2020, the government of Medical Council of India has already published one article or suggestion about telemedicine. And their suggestion also, they have also prescribed, given information about that, what as a registered medical you do the first examination of the patient, and what prescription would you give in the follow-up cases. Now there are certain list of drugs is there, list O, list 0, list A, list B, etc. Super is there 1, 2, 3. Now just like patient in person, when you are examining the patient, you can give the prescribed through telemedicine if you have gathered all the relevant information and other information about the patient. You can give. And in case of first examination, you can call video calling, and what you are telling that if you have some previous prescription for the follow-up cases, previous prescription, scan, etc., and latest information is that you can compare it. And but one thing that in case of follow-up cases, you should always give some prescribed medicine through video calling, and also over the counter which is available here. Otherwise, it is very difficult because list Another list is called prohibited degree, anti-cancer drug, you cannot give. That's in that way they have also prescribed it. I can say that.
Okay, sir. And this is my absolutely personal question. Personal question means uh, the doctors who are serve in the rural places,
Huh.
They have to do the postmortem examination,
Right.
and most of us are not really so much familiar to the postmortem.
Right.
Is it really acceptable to the court, or they can, or the institution can direct us to do these things, sir? Is it valid or invalid?
No.
What's your opinion?
Number one, till now, one is there that a registered medical practitioner can perform autopsy. That is written. Okay. And you are not getting so much of specialists throughout the West Bengal of different districts. So in that cases, many of us, our friend, like specialist of different specialty and also the medical officer are performing autopsy. But my suggestion is that they are now doing, but with difficulty, no doubt about it. If a regular basis training program is if there, then it will be beneficial for them. Otherwise, they have to do, because now a dictum is that registered medical practitioner can perform. So institutional head can say them, go. If there is no department of forensic medicine in the, especially in the district and subdivision, some medical officer, medical legal is there, but most of the area now, eye specialist, gynecologist, etc., they are performing the autopsy, no doubt about it. But we must, there should be a training facility so that they can be gainer after getting the training.
But
That
you
should
know,
be.
sir, you know the situation very well. That
Yes.
nothing is being done, and so the doctors are posted in the remote places, subdivision hospitals, and other things. It's really a burden to them.
Yes,
Definitely,
I do agree. I do agree. But most of the districts now, many of the districts now posted medical officer, medical legal. They are posted there, but not all districts. Few districts. I think that near future the government is thinking also in that way, and they will put it. But it will take time. But everything will be all right. But I do agree with you. This is a problem, no doubt, no doubt.
And
If
my last,
somebody tell me go and do a Caesar, it is not possible for me, isn't it, sir?
and sir, my last question on behalf of the general physician, that the doctor has not seen the patient has died, and 40-50 people attend the doctor's house or the chamber, asked him to really pressurize to give the death certificate, saying that patient was absolutely normal. He is suffering from so many diseases, and he was seen by some other doctors, and please do prescribe, give the death certificate. What to do, sir?
The one thing that if a doctor don't know about the reason, cause of death, so he will not issue a death certificate, no doubt. But your situation is another. One doctor, 40 people are giving pressure. There is no other alternative way. The one thing can be done. By pressure, he is giving certificate. He has given, but after returning to the nearest police station, he will just inform that I have given the death certificate by pressure. I don't know the cause of death. I am in doubt. So please look into the matter because they have pressed me. That is the intimation to the. So that can be acted as a defense of a doctor.
Thank
There
you,
is
sir.
no other way.
Thank you, sir.
Thank you.
I request Partha to really go over it. Please, Partha.
Thank you. There are a lot of questions. I'm going to ask Dr. Sukul.
Yes.
Suppose in such situation, I am meaning the last circumstances, it may happen to anybody who is practicing. So is it somewhat a defense to collect a certificate from the local councillor or panchayat or somebody of social significance of the community that where I'm sure that there is no, the patient was was sick and patient there was no foul play suspected in this case. Would it really help the?
Yes, because one thing, the problem, what problem will arise actually? If you give a certificate on the basis of paper, etc., etc., but all relatives are not good. Some relative will lodge a complaint that I am in doubt. The problem arises there. So if you go through all the paper, if you don't see the patient, if you go through all the paper, if there is you can assess that he was suffering from such and such disease, nothing else. Then if you are sure, then you can give, but totally depend upon you and what you are telling, that is the witness, local councillor or witness, or that is acts as a supporting documents, what I can say. But death certificate are giving by a doctor, so responsibility should be taken of his own. But in that cases, situations what Dr. Saha has already talking about this, that is a big problem. But one thing, if you don't know about the reason, or if there is no pressure, so you are not bound to give. And if
Sir, I'm
you have
asking
any
a
doubt,
question. Sir, when we joined medical college, we had to get a domicile certificate. So the process was that my panchayat, he had given me a domicile certificate. Then I went to block development office. They had given me another domicile certificate. Then I went to the subdivisional officer. He gave me a domicile certificate. Then I went to the district level. DM gave me a domicile certificate. Now, on the basis of the panchayat certificate, actually, the DM is giving the domicile certificate. And that certificate is taken as proof of myself being a domicile of such and such place. So in case where the doctor...
one thing I can tell, that in case of especially organ transplantation cases, if a donor is within the Calcutta and recipient is outside, now in that cases, the domicile certificate is a very important document for this purpose. And what I observed, that domicile certificate must be issued outside Calcutta by a SDO, no other. And in case of Calcutta, by a collector. And in case of outside state, they are maintaining the Form 21 by a Tahsildar, etc., etc. So SDO, if you give a domicile certificate, that will be acceptable, not Panchayat.
What I mean that ultimately the Panchayat certificate stands. Everything is based on that. So if a councillor supports no foul play in a case of a death, and if you have been faced by a big mob and everyone is telling that no, it's okay, you give a certificate and you're given a certificate. After tomorrow, some relation come out and they say there is a foul play, and then what to do?
Nothing.
If that domicile certificate stands, he is not penalized for the certificate. Why should you be penalized?
No, suppose one panchayat giving certificate, there is no foul play, and you have given on the basis of that certificate the huge pressure. But court is open. Any relative of the court can lodge a case. Then you will have to fight. A councillor also, they will call councillor. What he will say? No. As far my knowledge goes, I have given written. On the basis of that. But doctor, after getting confirmation that there is no foul play, I have seen the patient, but I have not seen the patient, but cause of death, I am sure, then I am giving. Otherwise, it is not possible. So contest may be there. What I mean to say that it is not all. I think that they can go to the court also. What I am saying here. But problem, there will be no problem also.
So nothing is foolproof that way.
Nothing is foolproof that way. That is the most important thing.
Yeah. Even if you cannot make a strong 100% sure diagnosis of foul play. A lot of things can happen without external injury marks.
Yes. And one thing that relatives, if they are dissatisfied, they can lodge a case in the court of law, and the court will again start a case by a lawyer. Then problem will arise. Why you have given? You are a doctor. He is not a doctor. You know about the cause of death. That's why you have written, etc., etc.
Regarding telemedicine, you are seeing the patient remotely, that too in picture, and the patient may be very sick. You have no access to the patient. You cannot touch the patient, neither see the blood pressure nor see the saturation. You have to believe whatever been said by the relations, and you have to prescribe on that basis and based on basis of the given papers, if any, or investigation, if any. It is an incomplete, absolutely inadequate assessment of the patient in most of the time. And based on that, you are giving your opinion, sometimes as an expert. And how far is the responsibility is legal, and for a mistake, it is quite possible. In such circumstances, you can
Yes,
make.
sir. Yes, sir.
But to save the patient's life, you may have to prescribe certain drugs. Whatever may be the list of the drugs, how can you save yourself? Are you really in danger of getting into litigations?
So
I'm very, very scared
Right.
and very uncomfortable about prescribing on telemedicine, because that kind of medicine is not well developed. It is
Right.
absolutely kind of very vague assessment of a patient.
Right.
Clinical examination, I always take as good as investigation, sir. I do not know my view is correct or not. If an investigation gives, say, 90% possibility of a particular disease, my trained clinical eyes, my clinical method also is as good as investigation, because it also gives me a certain assured diagnosis of a patient. Suppose if there is a particular sign, say palatal petechiae, that is a sign of bleeding or say thrombocytopenia. It is a very good sign. If I get that sign, it is as good as investigation, where I don't have access to platelet count. So what I mean to say, a good clinical examination is also an investigation. And a doctor should not be rebuked or scolded or penalized because he has not done investigation in a particular case for different reasons, maybe lack of facilities, maybe financial constraints, maybe anything else. I have got a question here that it happened to my experience also, that a patient expressed that he is very poor, he cannot afford investigations for interstitial lung disease, where you have to have a lot of investigations to evaluate a patient. And after a few days, once I've given treatment, somebody appeared and said, "Doctor, you have not investigated my patient properly." Although it didn't end up in anything bad, but finally I had to say that, see, this was a situation, I restrained myself. My asking this question is to get a guidance from you what to do in such cases.
No, sir, one thing, sir, you have rightly told that problem lies here. But one patient, your first suggestion will be, if the patient is emergency condition, so your first suggestion will be that take advice from a local area doctor. That should be the ideal approach, because I have not examined you. If it is possible, in-person examination is very important in that cases. And if it is remote cases, then you can tell that go to the nearest hospital, because problem is there. The drugs, what you are telling, now telemedicine published by the Medical Council of India, there are few drugs, that is HNO0. One drug is always can be given, that is a paracetamol, ORS, etc. Another types of drug, video calling is must. You can call video, and after that you can give over counter medicine. And lastly, the anti-cancer drug is prohibited. That is written. But problem lies that you have given investigation, they are not doing this thing. How will you approach? That is the most problem thing. So better in that cases, ideal approach should be you go to the nearer hospital and take advice from a doctor, because I am not examining you. If you can call in video, but without examination, especially in that case of emergency cases, you cannot judge the patient. Na? So ideal approach should be, first of all, go to the nearer hospital.
So there are a lot of questions. I asked my colleague to ask you one by one. On behalf of Sankar. Shayoni, can you ask the questions one by one to Sir?
Yes, sir.
Please.
Okay, the first question is, these are from the audience. Should we issue a death certificate to age-related national death at home but not witnessed by a doctor?
Please, pardon, please.
Should we issue a death certificate to age-related natural death at home, not witnessed by a doctor, if not witnessed by a doctor?
কোশ্চেনটাই বুঝলাম না। ন্যাচারাল ডেথের এজের লোক হয়েছে, তাকে আমি ডেথ
তাকে
সার্টিফিকেট
কি, হ্যাঁ, In case doctor has not witnessed it, but বাড়িতে হয়েছে natural death, কিন্তু ডাক্তার বোধহয় মানে I think this is the interpretation.
Died at home.
Died at home.
In a very old person.
ডাক্তার কি তাকে দেখেছে না দেখেনি?
দেখেনি।
যদি না দেখে থাকে তাহলে first answer thing is that if a doctor is not confirmed or not sure about the cause of death, he can refuse, because it is the liabilities of a doctor if he issues the death certificate. If he is not sure about the cause of death, that is the most important. But if he is sure about the cause of death, he knows that he is suffering from such and such, I can give, then that is his jurisdiction, he can issue. But without examining going examination of the patient, if the patient expired in the house, it is the jurisdiction of a doctor if he is sure about. But practically we are doing that thing. That is the most important thing. But he has got every right that without knowing the cause of death, I cannot issue.
Okay, thank you. The second question is, can you guide regarding indemnity plan for doctors? Who should take the plan and when?
Generally, the doctors who are now the enactment of Consumer Protection Act, everybody should get insured himself. It is my suggestion, because if you go through the mediclaim, then you just give a 6,000 premium per year and you will be covered by 20 lakhs rupees. And in case of any litigations, that company will fight on behalf of you, and they will provide a lawyer. So better to insure. It is my suggestion.
Sir, just an interjection. I heard that the High Court ruling that health is purchasable in India has been squashed by another ruling by another High Court or Supreme Court, that health is no longer purchasable as per law. And in that case, our profession is not taken into consumer.
That is included, I know, but we are not sure till now. But debate is going on still. What you are telling, that is not within the purview of doctor, because initially in the year 1986, when Consumer Protection Act established, that was not within the doctors were not included within that purview of the Consumer Protection Act. It is in the year 1995 where the doctor included. And latest what you are uttering, we are not sure whether doctors are still exempted or not. Dicey area is there. But it will be very
soon settle possible.
हो जाएगा.
अच्छी बात है. There are questions left, sir. Any website or information portal for doctors to keep updated regarding medical legal rules? Like a lot of things are changing. How one can be kept updated? Is there any website to help us?
That can be done. Number one, if any medical legal, any chapter or medical institutes of the states is there, that is one thing. They can upload that through a website. Everybody can go through it. And otherwise, from the government side, any experts, one organization can give suggestion to the government. You just give some information, latest information or updating. So website, two things. One, chapter wise, that is like your chest organization. In the state, organization of medical legal issue or medical institute can go for this website.
Actually, really, there is a real dearth of such dissipation of information.
Right.
Because neither the government nor the professional bodies are interested in such
now I can say that though I am not very active, but I have given suggestion to my organization to give such type of things. I have already advised them. I don't know how far it will go through.
Let it go through, and let somebody make up such a resource for all the doctors in the country.
Thank you, sir.
So there is another question: should we take consent for emergency procedure in casualty room? Sir, I have a follow-up of this question, because I know a particular scenario when a doctor He rushed to put a chest tube in a patient who was actually dying. Had he not have placed that tube, the patient would have died within minutes. And later he was dragged to Medical Council of India for doing procedure without consent. And he was rebuked, but his nothing else was done. I felt very sorry for the doctor, and this actually has a very kind of negative impact for those who are proactively helping patients. So what is your idea? That everyone, the patient is dying in one side and you are asking for somebody who is a relation, no, give consent, without consent we cannot do. And if you do without consent, you have been dragged to court. So this dichotomy cannot go on. It's an issue of humanity. If you respect humanity, doctors should be given that kind of power or respect so that he can decide for a particular patient who needs urgent intervention for life saving, and for that he should not be rebuked, or he should not be penalized anyway.
One IPC is there, 92 IPC. IPC number 92. That is for the protection of the doctor, because your clause will be for the interest of the patient and in good faith. So I think that he will be protected. He will be protected.
But unfortunately, he will rather be rewarded, sir. Unfortunately, the case I mentioned, this has happened to a known doctor to me. He was rebuked by the medical council members at the meeting. Nothing happened afterwards, but he was so sad. Anyway,
right.
There's one
but he will be protected in the court of law, I think. Because there is one IPC is 92 IPC.
We'll remember that IPC, and I request everyone to remember this IPC. And I feel that there's no harm if you, doctor should not restrict himself for life-saving procedure
For good
just
faith,
for
the interest of the patient.
For the interest of the patient, right. The question by Dr. Jayanta Chatterjee, can I talk to the patient within earshot of another patient? That's important. Or does that break his confidentiality? Yeah, in district hospitals, there are 2-3 patients on single bed, maybe 2 beds are within a feet or 2 feet apart. You're asking something to a patient, the other patients are overhearing it. Is it not break up confidentiality? You are asking for confidentiality, and you are actually in a circumstance where keeping confidentiality is not possible. So what is your take on that?
What can I say?
No, it's very practical question.
That is a practical question, and you'll have to deal in practical way.
What is my duty if I see a colleague doing something illegal? This is a very, very good question.
That is a very good question.
You are not an employer. If you were an employer, then another thing. But as an ethical person, as a good colleague, as a human being, you can request him that you are breaking the moral principles and you are violating the ethical aspect. Don't go that. And if he don't listen you can say that you are doing wrong. Ultimately, you will have to suffer, etc. And finally, you have the right to lodge a complaint. Finally. But first of all, as a colleague, you give ethical approach. You just refrain from that thing, request you to refrain from this thing. You are doing unethical job. That shouldn't be there. You are violating the moral principles. As a friend, you can guide it. As a court, if is going on too much, then you have got every right to lodge a complaint. Nothing else.
So there is another.
Partha, may I ask a question?
Yeah, sure.
Dr. Sukul.
Yes.
As a pulmonologist, a problem we regularly face in the nursing home, that a patient is on ventilation. After 4 or 5 days, they can continue the nursing home charge and other things. They ask the doctor, we can't continue these things. But legally, we take the house staff of the RMO take the written consent that we don't like to continue this life support measure, and they really stop this ventilation. Is it not a medical legal case?
Number one, sir, ultimately two things. Medical legal, number one, the patient is on ventilator. If
Yeah.
the patient in terminal stage, and if you as a doctor assess the patient that no improvement will be there, he is in the terminal stage, then it can be done on the request. But one thing, in the year 2011, High Court actually observed that they have prepared how to withdraw the ventilator. So they suggested, as per law commission, because further enactment is not there, the High Court will prepare the 3-body expert committee. The party will apply to the court, or then 3 persons will go and ultimately they will see and suggest that withdraw can be done. The practitioner under whom the patient is admitted, he can then withdraw the. This is one of the matter in 2011 law commission they have observed. But one thing, if as a doctor you think that the patient is terminal stage and no help will be done, if continuation of life, rather by treatment or by intervention or by anything, he is in terminal stage, then withdrawal question arises. And if they by writing they give a consent, ultimately these are happening, isn't it? But what I am telling, law commission also observed that thing 2020.
But it is not legally tenable.
আছে কিছু কিছু কেসে হয়, বড় বড় কেস এগুলোতে হয়
না, কিন্তু if they put me in the court,
কোর্টে গেলে তো আপনার একটা উত্তর থাকবে। আপনার তো সবচেয়ে বড় উত্তর হচ্ছে যে আমি ডাক্তার, আমি বুঝতে পারছি টার্মিনাল স্টেজে আছে, তাহলে টার্মিনাল স্টেজে গিয়ে তার আর লাইফে রিব্যাক করার কোনো প্রশ্ন নেই। আমি তাকে বারবার করে ভেন্টিলেটর উইথড্র করে দেখেছি, তার ডেভেলপ করেনি, তাহলে এখন সেই পেশেন্ট পার্টির সব দিক থেকে বাঁচাতে গিয়ে আমি গুড ফেথে সেটা বলেছি, এবারে সে লিখিত দিয়েছে আমি শুনেছি, সেটা বলার জায়গা আছে। কিন্তু আমি ল কমিশনের কথাটা বললাম।
না, লিখিত কিরকম দিতে পারে, যে
লিখিত না করলে ওরা ভয় পায় না যে পার্টি তো পরে ঝামেলা করতে পারে, সেই জন্যই তো লিখিত দেয়। হ্যাঁ, বললাম তো মেডিকেল লিগালি আমি একটা কথা বললাম, ওই যে বললাম, আর বাস্তবে যেটা, যেমন ডেথ সার্টিফিকেট, ব্রড ডেথ কেসে আমরা তো ছোটবেলা থেকে করেছি, আমরা জানি না কি করে।
প্রবলেম স্যার, in our pulmonology,
that is a medical legal issue.
This is really a medical legal issue. I don't know the solution.
And that's why I am telling you that after সাহানা জোসিনে মারা গেল না, শাহানাবাগ, তারপরে এই ঘটনাটা ঘটেছিল। তার তো উইথড্র করেনি প্রথম, তারপরেই হাইকোর্টে গিয়ে 3টে এক্সপার্ট কমিটি করে এইগুলো ব্যবস্থা করেছিল। এবং এখনো পর্যন্ত পার্লামেন্ট বা রাজ্যসভায় যেহেতু গ্যাজেট নোটিফিকেশন হয়নি, সেখানে বলে দিয়েছিল ল কমিশনের যা সাজেশন দিচ্ছে সেটাই অ্যাক্টস অ্যাজ এ ল টিল যতক্ষণ না পাবলিশড হচ্ছে। সেই কথাটা আমি বললাম আপনাদের।
আমার কথা হচ্ছে যে ডাক্তারকে সমস্ত রকম বিপদে ফেলে দিয়ে তারপরে কোর্টে টেনে নিয়ে যা,
কোর্টে টেনে নিয়ে যাওয়া মানে যে কোর্ট যে কি জিনিস,
হ্যাঁ,
সে বোঝাতে পারবো না, মানে যারা গেছে তারা জানে, আমাদের প্রায়শই যেতে হয়।
সে তো আপনাদের যেতে হয় না। আমার কথা হচ্ছে যে আমাদের সমস্ত রকম বিপদে ফেলে দিয়ে, পার্থ যেটা বললো, কাউন্সিলর হেল্প করবে না, সব অস্বীকার করে যাবে, আলটিমেটলি আই হ্যাভ টু গিভ সামথিং।
সেই জন্যই তো আমি ডাক্তার, আপনি ডাক্তার, জীবনে সবচেয়ে বড় কি করবো, আপনাদের বুক টিচিং বলতে গেলে বাস্তবে তো বুক টিচিং হয় না স্যার। আমি যা যা বলছি স্যার, বাস্তবে আমি কি ফলো করতে পারি? আমিও পারি
না স্যার। এই 67-68 বছর বয়সে এসে এখন যদি কোর্টে ছুটতে হয়, with a lot of this background good faith,
তবে কোর্ট, বাট ওয়ান থিং আই ক্যান সে ইউ দ্যাট কগনিজেন্স কোর্ট অতটা জাজ সাহেব ব্যাপারগুলো বোঝে, অতটা এ দেয় না, সব ক্ষেত্রে পড়ে না, একটু মানসিক অশান্তি হয়।
মানসিক অশান্তি মানে এ তো সাংঘাতিক রকম, সাংঘাতিক মানসিক অশান্তি,
সেটা বলতে পারি। দ্যাট মাচ আই ক্যান সে।
অর্থ আর কোশ্চেন?
Role of WhatsApp advice we are doing quite often.
ব্যাপারটা হচ্ছে, দেখুন এখনকার নিয়মে ইমেল ফিমেল কিন্তু অ্যাকসেপ্টেড, হ্যাঁ, আমাদের সমন কোর্টে সমনও ইমেলে আসছে, কিন্তু ওই হোয়াটসঅ্যাপের তো আইডেন্টিটি অতটা নয়। আমার মনে হয় একটু কনফিডেন্সিয়ালিটি রাখা ভালো, একটু ভালো। একদম যেখানে উপায় নেই সেটা আলাদা কথা, কিন্তু এখন
You
ইলেকট্রনিক
mean to
মিডিয়া
say that you have to give WhatsApp advice selectively only to those you know very dearly, and
হ্যাঁ
those who
হ্যাঁ,
are
আদারওয়াইজ হ্যাঁ, আদারওয়াইজ
right. So it will be a little selective WhatsApp advice, but it is not unfair. You can give.
বাট হোয়াটসঅ্যাপ, বাট আই ক্যান সে দ্য মেল ইজ মোর অ্যাকসেপ্টেবল, মানে মেল ইলেকট্রনিকটাকে ওরা ধরে নিচ্ছে।
When you can give advice on an email.
হ্যাঁ, ইমেলে কিন্তু আমি তো দেখেছি সমন থেকে শুরু করে নোটিফিকেশন সবই তো আসে। ই
If
প্রেসক্রিপশন তো
telephonic
আমার
advice
আছে।
is, sir, if telephonic advice is not legal, huh?
Which?
Sir, telephonic advice is not recommended, but why
Telephonic
you?
advice I will not allow, মানে I will not support it, because telephonic advice এ হয় কি দেয়, কিন্তু অনেক সময় মিসআন্ডারস্ট্যান্ডিং হলে প্রবলেম হয়। টেলিমেডিসিনটা ঠিক আছে, কিন্তু টেলিফোনিক অ্যাডভাইসটা।
Acha, acha. So Supreme Court has long announced a verdict. You have to write in block letters to those doctors whose handwriting is not legible, to all other chemist shops except chemist shop where they are practicing it. It is also a malpractice. Is it so? But who bothers, sir? What is that?
Obviously, generic নেমে যেমন বলা হয়েছে যে you will have to write the prescription in generic names in capital. Why? Because some pharmacy or the person is not understands the writing. So it is a verdict given by a Supreme Court. So you will have to follow the verdict. How much I can say? You will have to follow the verdict of.
We have to practically follow the verdict.
Yes.
Yeah.
Yes.
Sir, what about your advising audio video recording as a proof of what patient said in court?
No, audio video method is one of the proof, no doubt about it, because various cases, audio and video interviewing, during interviewing, it is now in vogue. So you can take it, audio video, that is a proof, evidence-based thing.
I think it can be other way also, because the question is, sir, can audio video recording of OPD Act as proof of what patient said in court? I mean, patient can go to court, you are busy in the OPD, at momentarily you may be saying something which is not very up to the standard of it, your etiquette or something. Can they prove, can it be as a proof against you?
Another question is there, sir. Another question is that in OPD, if you put a camera, the person's personal examination is there. That may be one of the counter question. I don't know, that maybe, because you'll have to maintain the professional secrecy and privacy.
But there have been cases where people have falsely tried to malign a doctor. Actually, nothing happened. And had there been a camera in that place where private examination is not recommended in those places, maybe in non-gynecological,
Yes,
and
yes.
that may save a doctor. The doctor say, well, you can see what I'm doing. And I'm informing you beforehand. You are under video surveillance. So is it okay?
That is true. But one thing you should keep in mind, that examination is also including private and exposing. So that's why it may be challenged. That's why I'm telling. That depends area to area.
So there are many more questions. Shani, can you pick up something from the chat box? So people are asking so many questions, and there are so many, I mean, congratulations to you, sir.
Thank
Good
you, sir.
discussion.
Thank you, sir.
So, sir, slides not evident. Okay. Someone miss a point, and so, okay, sir. Suppose someone missed a point to note while examining a patient in emergency. And on the hindsight, after going back home, he thinks that, well, that point was perhaps important, and that might actually signify a foul play, that you have missed to inform police at that point of time. What should you do?
Number one,
is there any way to rectify? It happens in a human form.
Yes, if you issue that injury report to the police, you don't go for rewriting, number one. You can inform the police personally that I have examined the patient, I have prepared the injury report, but one thing I have forget or missed, that it is this thing, this is for your information, and that should be documented.
Well, sir, if the information is not informed to police because the doctor at that point of time didn't think that it is important, but later he felt that, well, that can be a case of some suspected foul play, would he be doing the right thing to inform the police that, well, this case, I missed its particular point? Would it be, what is yours advice at that point of time?
Now, at
Suppose
the
a mistake
time of, if you issue the certificate to the police personnel, it may be possible that they will Xerox it. You don't know. So better not to rewrite there. It is my suggestion.
Okay, that's okay. But if you have not informed the police, but you should have informed the police. And now on hindsight, you feel that I should have informed it to police. The case is already been admitted and police case is not done, or the case has been seen. So, well, the
Police
doctor
cases
can.
must, in case of police cases, you must inform
So
the
whenever he
police.
suspects, maybe after 24 hours also he will do it. He should.
As early as possible. Yes. First of all, your duty to save the life of the patient. Don't go for writing the injury report or police. First to save him.
Does a doctor need to write down the financial status of a patient or logistic constraints if the patient cannot afford? Suppose I just gave you the example of ILD. We need to do CT scan, we need to do bronchoscopy, we need to do a huge battery of tests to understand the disease. And many of our patients cannot do. Actually, in real world, most of the tests are not done, but still given treatment. But once in a blue moon, somebody can come up and say, you have not investigated the patient and given treatment, and you have caused harm to my patient. So will it save me if I put a note in my prescription that logistic constraints?
Yes. You can write one thing. I have advised for investigation, but it is not compliant. Logistic constraint is no doubt. He refused or not complied, but no result. That note is sufficient.
So better is to write the whole battery of tests and then forget. If he does it, okay. If not done, then it is not your headache. But you have to write all the investigation.
You have given advice, but his financial constraint or other things, he is not doing that thing. But you have advice. That is the document that you can show in the court of law.
Okay, sir. So these chances are really low, but still, telemedicine prescriptions without examination is legal. Is it legal? That was one question.
I have already discussed.
If I'm in discussion with a patient in a place where other patients can overhear, oh, that's been already asked, and there's consent process is not possible as a patient is in a, that has been asked. Will you, sir, just excuse me. You will not clinical examination in video calling so prescribed medicine is legal. I couldn't understand the question. I couldn't. Thank you so much, sir, for your enlightening talk.
We have one last question, sir. Another last question is there. Is withholding a discharge of patient for lack of payment legal?
Pardon?
Is withholding a discharge of patient for lack of payment legal?
This is not my domain. It is the domain of the administration. What shall I do?
Doctor is not responsible.
Yes, why should I? It is the administrative part.
Legal or illegal, whatever. So
yes, because administration will do this thing. I am a doctor. Can I hold? Can I relax it? Isn't it?
Great. So these were the questions. It was a wonderful discourse. So
thank you, sir.
Sankar, please.
And thank you, Partha, Dr. Sukul. Wonderful and very enlightening discussion And
Thank you, sir.
we know that all the problems cannot be solved. Doctors are always on the receiving end.
Right.
And that's why we are doctors.
Yes.
So, আমার একটা কথা বাংলা কথা মনে পড়ছে. One patient came from very far away from Krishnanagar.
Hmm.
আমাকে একটা কথা বলেছিল. He has given me 5 rupees coin, and that is what is my fee? That is a huge amount of 5 rupees coin.
Hmm.
And আমি বললাম এত টাকা দরকার নেই। তখন উনি বললেন, স্যার ডাক্তার কি যে কেউ হতে পারে? তার ডাক যে পায় সেই ডাক্তার হয়। So we have to bear with these problems in life, sir, and we have to go on till our death.
ঠিক, ঠিক, ঠিক।
Thank
I
you,
have a
sir.
small question. Thank you,
Yeah.
thank you, Sankar.
Thank
I have
you.
a small
Thank you.
question. Sir, I can see a patient who is causing direct harm to the society and to his family.
I can
Like a
see.
patient.
Pardon?
I'm seeing a patient. Suppose I've got a patient who is a MDR tuberculosis. He's not complying to my advice. He's spreading the disease to his family and to the community.
Hmm.
So actually, he should be. Can I take legal steps against him? Can I?
Number one, in spite of your repeated advice, if he is not obeying your advice, you can discharge the patient from your control. Number one, if he is under employee of any organization, you can inform the employer that it will be harmful to him and he will spread his disease to the office colleague and also the family member. That step you can take. You can inform the employer. And lastly, society, for the benefit of the community, you can go. Because as a doctor, you don't want to spread this thing to the others.
No, someday I had similar problem. I was so excited. I told him that I will go to and I'll sue you in court. You are actually harming a lot of people, including me, my colleagues,
Right.
and everybody. You have no right to do it.
Right.
In a society, you cannot live like this.
Right.
So,
Right thing. So these are the steps.
thank you, sir.
Thank you, sir. Thank you.
So with this all, Dr. Sukul will call you time and again. Every time we have to have a medical legal session in our Pulmocon. Pulmocon will continue.
Thank you, sir.
And I'm really grateful to you. I'm really grateful to Sankar with wonderful questions from his personal stock. And I'm grateful to my audience who have been very, very interactive. And most of them are giving a lot of thanks to you. There's one more question right now. During consent, the consent, just a moment. Is consent by any relative is okay? Or who should take any specific relative consent as per law? Or
Number one, if the patient is more than 18 years of age, if he is conscious, his consent is more valid. Number one. If the person is minor, then the legal guardian will give consent on his or her behalf. Next, if anybody is not present, then proxy consent we are talking, they can give. And lastly, any consent called the loco parentis. Suppose one boy is admitted in the hostel, warden of that hostel can give a consent on his behalf. These are the methods.
Right. So wonderful. Thank you. I again thank my audience for such wonderful interactions. Next Sunday we'll be off, and next to next Sunday we'll be again coming with another version of Pulmocon module. And after that, possibly maybe 1 or 2 modules, and then we'll stop Pulmocon 2020. So with this, I thank all of you once again.
Thank you.
Thank you.
Thank you.